Good evening and Merry Christmas. My name is Robert Groves and I am a student at ECPI University. This evening I'm bringing to you compelling arguments about why it is time to pass the Improving Access to Affordable Prescription Drugs Act. For years, taxpayer dollars have driven medical innovation, and taxpayers deserve more in return for their monetary support. Instead, Americans pay the highest prices in the world for pharmaceuticals, or as often in the case, go without treatment because the medicine they need is unaffordable. Nearly 1 in 5 American adults aged 55 and older report skipping doses or not filling a prescription within the last 12 months because of cost. This is simply unacceptable. The Improving Access to Affordable Prescription Drugs Act, also known as the Affordable Meds Act, would bring down prescription drug prices and effectively challenge the pharmaceutical corporations' economic and political power. It is sensible, it is long needed, the bill is comprehensive, and is worthy of broad-based bipartisan support. Among other reforms, the Affordable Meds Act would curb the monopoly abuses of prescription drug corporations that keep prices high, penalize those companies that engage in price gouging, and finally allow Medicare to negotiate fair prices for senior citizens, cap out-of-pocket medicine costs in health insurance plans, and require the most feared of all, transparency from pharmaceutical industries. Ladies and gentlemen, there is no doubt that drugs save lives. For centuries, science pioneers have discovered new chemical compounds that have worked miracles in the lives of people and miracles around the world. It goes without saying discoveries have a cost. At what amount, ladies and gentlemen? In the past 48 years, drug costs have risen 4 times larger than the United States economy, from 5.5 billion to 328 billion in 2016. However, if ordinary citizens cannot afford these new discoveries, what benefit are they? There are 6 sobering facts about today's prescription drug prices I would like to share with you. Number 1. 90% of Americans use prescription drugs. Number 2. 37% of the average Social Security check goes towards out-of-pocket health care costs. Number 3. Americans pay the highest price for prescription drugs in the entire world, resulting in nearly 1 in 5 U.S. residents, that's 35 million people, not filling a prescription each year because they simply cannot afford it. Drug makers, often under the ownership of hedge funds and private equity firms, routinely increase prices for certain drugs without improving the therapeutic value to patients. This especially happens when patents run out, and then the drugs are rebranded. In 2015, 5 of the largest drug corporations made more than $50 billion in profits by manipulating the drug market to artificially inflate the cost of generic drugs and by reformulating and rebranding existing drugs. The Medicare Modernization Act of 2003 prohibits the federal government from negotiating drug prices. However, the federal government can use its bulk purchasing power to benefit veterans enrolled in the Veterans Health Care Administration medical programs and Medicaid recipients. It is time that our senior citizens receive the same advocacy from the federal government as our veterans and as our citizens in need. Ladies and gentlemen, fellow citizens, now is the time to get behind the Improving Access to Affordable Prescription Drugs Act and make prescription drugs affordable to all who need them by doing 4 things. Allow Medicare to negotiate fair drug prices and accelerate the closing of the Part D donut hole. allow residents and pharmacies to import safe, affordable drugs from Canada, and they are proven to be effective and safe from other countries as well. We are in a global market. We trade all types of goods and services across the globe. It is time to do this for our pharmaceuticals. Require drug corporations to disclose financial information, including their profits and pricing information. And finally, increase the competition of generic drugs and incentivize innovation among drug corporations. There are 3 stories from our fellow Americans that I'd like to share with you specifically on this issue. First, Lynn from Elk Grove, California says of her family's health costs, which come from prescription drugs, her husband's Plavix is now over $205 per month. However, if she buys it from Costco, she can get $40 less than her insurance. These vital drug costs are totally out of control. Lynn says that her husband tried to access the generic, and he did take it for a while, but then couldn't tolerate it any longer, so he stopped taking it, and now he's not taking anything for his heart, and it upsets them. She says Plavix used to cost $90 for a 3-month supply, but last year when it went up, their costs went up also to $205 per month. That is just unbelievable. Then there is Foxine from Belleville, Illinois, who writes that the cost of my diabetic test strips has gone from $12.86 in 2014 to $56 in 2015 for a 9-day supply. I know it may not seem like a lot, but the percent increase shows what is happening. Now, these are diabetic test strips that are used on a daily basis. And in speaking with Foxine, I found out that there was no improvement to the diabetic test strips. Same diabetic test strips that she was ordering in 2014, she was receiving in 2015 with a substantial increase in cost. And then finally, there's John from Atlanta, who shares that my prescription drug plan charges me $136.87 per month for Advair. Due to the cost, I only use it when I am experiencing severe breathing problems for 1 to 2 months. I then go off it until the next serious incident. My doctor doesn't like it, but he understands and gives me a few 7-day sample packs. The website on John's insurance plan says that there are no covered formulary alternatives available for the drug. John finds himself using albuterol more often to avoid having to use Advair, but even the cost of albuterol has gone up. It used to be that he could get albuterol inhalers at $10 each, or $20 for 3, but in the past year, when the patent ran out on albuterol, the company rebranded the same inhaler, same chemical makeup as ProAir or Ventolin, and the drugs went from $10 per inhaler to $45 per inhaler, or $90 for a 3-month supply. Any cost borne by regulating the Improving Access to Affordable Prescription Drugs Act will be gained back through revenue-generating activities from enforcement. First, pharmaceutical corporations will be required to disclose revenues, profits, levels of sales, pricing information, contributions to patient assistance programs, federal benefits received by the manufacturer, executive compensation, and other factors. The bill would allow the Secretary of Health and Human Services to negotiate Medicare Part D prescription drug prices with prescription drug companies through use of techniques the Secretary deems appropriate, including potentially through use of formularies, reference pricing, discounts, rebates, other price concessions, and coverage determinations. This measure alone could save the federal government millions of dollars annually. Section 202 of the bill would impose a tax on prescription drug companies that raise the prices of their drugs beyond the rate of medical inflation over an annual period. Also, revenues from annual price spikes beyond the level of medical inflation would be fined. Those that raise their prices less than 15% would be fined 50%. Those who raise their prices less than 20% would be fined, but greater than 15% would be fined 75%. And then those who raise their prices more than 20% in a given year would be fined at 100%. The revenues collected under this section of the bill would be appropriated to the Secretary of Health and Human Services for the purposes of funding or conducting research on economic and policy implications of price patterns of prescription drugs, or increasing the amount available to the National Institutes of Health for research and development of new drugs. Section 301 of the bill requires redirection of already allocated funds into two new programs. First, the Treasury of the United States will establish an antibiotics price fund of $2 billion in fiscal year 2019. During a 10-year period following enactment of this bill, the bill would require the Director of the National Institute of Health to award up to 3 prizes or products that provide added benefit, demonstrates their superiority in clinical trials to patients over existing antibiotic treatments, and award open-source dividend prizes for contributions that advance antibiotic research with openly sourced materials, technology, data, and knowledge. Second, the National Institutes of Health would provide public funding for clinical trials. Each year, the Director of Institute would select 2 molecules, compounds, drugs, or biological products on which to conduct clinical trials at the Institute or enter into contracts with other entities to conduct such trials. Costs of studies conducted by the Institute and with subcontract agreements under this section would be made public. $1 billion would be appropriated each fiscal year 2019 through 2028 to carry out this section. It is morally wrong that in the richest country in the world, people are denied access to the medicines they need because they cannot afford them, as is the case for millions of Americans today, and as is the case of the 3 examples I shared with you. Americans support by wide margins and across party lines strong action to reduce medicine prices and end the monopoly abuses of prescription drug corporations. It is time for elected leaders to unite behind a real priority for Americans, lowering prescription drug prices. Americans demand greater access to affordable medicines. There is strong evidence that voters want reform in this area, and the Improving Access to Affordable Prescription Drugs Act will deliver on these expectations. I thank you for your time and attention to this worthy cause.